Hello everybody, my name is Rajesh Dubey from RD Wellness. RD Wellness is providing support to the patients who are suffering with many chronic diseases, primarily diabetes, hypertension, arthritis, and the one which leads to many of these conditions, that is obesity. We provide support in the form of consultation, in form of our DietEx program, where we help you over a 6 months course that is having different elements of diet and exercise, and the intended outcome is that you will be either reversing these chronic conditions, or you will be able to control significantly and regain your good health and live a better life. In this video, which is the first of the 5 different videos I'm going to share with you on diabetes. The contents are from my book, Control Your Diabetes. I can provide a free copy to you if you are interested to read the book and understand how you can control your diabetes. In this different 5-part video, I'm going to share with you the 5 different aspects, starting with what is diabetes and how it occurs. In the second part of the video, I'll be sharing with you something that we will be addressing on what are the key risk factors which lead to the diabetes. In the third and fourth part, we will be touching upon diet and exercise which you can take in order to reverse or control the diabetes. And finally, we will look at some key examples and some case studies which will be useful to you to get some useful tips while you implement all these programs. Okay, so let us first understand in the first part what is diabetes and how does it occur. Okay, now everything about the diabetes has to do with the sugar. You already know it. Why the sugar comes into the play? Because sugar is an essential part in our blood. Okay, your blood contains sugar. Now the trick is that the sugar in your blood can only be in a certain range. What is that range? Normally, when you can say when your body is at in the resting condition, and that I'm telling you well after you have taken your any meal, let us say 5 to 6 hours after you have taken any meal, the normal range of sugar is from 70 to 100. Now what happens if you eat the food? If you eat the food, the sugar level is going to increase beyond 100. Then what the body is going to do? Because it will try again to go back to the normal range, that is 70 to 100, 3 things are going to take place. Okay, the first part is that some of the glucose is diverted to your cells. Okay, your cells are going to use the part of the glucose, the sugar, to create energy, to generate energy, and that energy is used in our day-to-day function, in the functioning of cells and our body. Now obviously the cells cannot use all the glucose, and therefore whatever amount of sugar is remained after fulfilling the requirement of cells, a part of that sugar is going to be used to synthesize glycogen. Okay, what is glycogen? Okay, the glycogen is the reserve form of the carbohydrates. It is stored in our body, and whenever there is a need, whenever your body is deprived of sugar, then this glycogen is going to be broken down into the glucose, and that glucose can be used by the cells. So that is the second step. Okay, and still if your body is in this range, still if it is having more amount of sugar, then that sugar is going to be used for generation of fats. Okay, so these are the 3 essential process. Number 1 is the use or the consumption of the glucose by your cells. Second is generation of glycogen, and third is the fat. Now for all these 3 process, you need insulin. So insulin is a hormone that is created in your body by one of your organ. We don't need to know about the name of the organ. So that insulin is secreted whenever or as soon as the glucose enters in your body and it spikes this range. Insulin gets the sense and it starts getting into your blood, and there it starts following all these 3 activities step by step, first, second and third. Okay, it also means that if you eat very less amount of sugar, then only first and second are going to take place. If you take a large amount of sugar, then all three are going to take place. A red line you see, when the range of the sugar is shifted from 70 to 142, let us say this level, that condition is called as a diabetes. Diabetes is actually a combination of multiple diseases at some point of time. Initially, it starts with a high blood sugar, and then it slowly creates many problems. Okay, it branches into multiple issues and challenges. Most of the challenges are in the form of cardiovascular problems. So you may have hypertension. Many of the patients develop heart-related issues, and stroke is unfortunately one of the major event in the patients who are having the diabetes. In addition to cardiovascular event, you may get the blindness, you may feel some sensory issues including pain, and even you may develop some kidney related issues as you progress further on the disease cycle. This is very important. You should be very clear that why it is very important to stay away from diabetes, because diabetes of course itself is challenging, because every day you have to manage your sugar level, your food, you have to ensure that you are taking medicine. But in addition to this everyday management, at some point of time you are going to fall victim to any one, two or more than two of these conditions. Okay, and this will result into more medical cost, hospitalization, and all the problems not only to you but also to your family members. Okay, so let us come to the second part, and that is how diabetes occurs. If you see the response between the insulin and the glucose, a typical healthy body will have this kind of response. The moment glucose enters in the blood, you also see, or there is also a release of insulin in the blood, and the insulin leads to removal of glucose from the blood so that it comes back to the normal range. This removal is done in the form of three different steps that we just discussed. The first is some part of the glucose goes inside the cell, some other part goes to synthesize the glycogen, and the remaining part, whatever is left, that goes to form the fats. When any person becomes diabetic, then this is a typical response. What you see different between this and this is, here insulin is present in sufficient amount, but here the insulin shown by the red curve, it is substantially small, which means that there is very small amount of insulin release as compared to glucose. What is the consequence? The glucose remains for longer time and it remains at very high concentration. So this is a typical reason or typical scenario in the diabetic patients. Now the conversion from the healthy to the diabetic situation is not sudden. The patient passes through a number of steps that we call as insulin resistance, we call as a metabolic syndrome, and we will understand each of those phases. But very quickly what happens is, over the time, when one, two or more of these three steps they start misbehaving, the body is forced to do more when it comes to release the insulin. Okay, because as I told you, insulin is the main thing that leads to removal of sugar. If sugar is not going out, what will happen? The natural reaction of the body is that it will accelerate the release of insulin in the body. Okay, and therefore let us say a typical graph can be, if this is your sugar which is going to be a little for longer time as compared to this very short time, but this for the longer time, your insulin is going to be released in much higher amount. Okay, so you see that the release of insulin is much higher, and that too for the longer duration as compared to the normal body or a healthy person. And this scenario, which we call, or we may call as a pre-diabetic condition, it goes for very longer duration, for a number of years before a person is converted into the fully diabetic situation. Now this condition that we call as a pre-diabetes, this is also present in the early stages of diabetes, and this is primarily the situation or the condition when a person is capable of reversing his situation, his medical condition, so that he again goes back to become healthy. And this is the entire purpose of employing diet and exercise based program that we call as a DietEx program, so that we assess that if he is at this stage or at the early stage of the diabetes, then again he is brought back to the insulin level. Number one. Number two is, still if the patient has become fully diabetic, let us say anybody who has been on the medication for 4 to 5 years, now there is definitely a chance to control it, and those changes will help you to reverse the diabetes or to control it in a significant manner. So these are the different objectives. We will discuss multiple solutions when it comes to understanding the role played by diet and exercise in the next few parts of this 5-part video. Talk to you in the second part.